Sir, with your permission, sir. Thank you so much, sir. Assalamu alaikum, sir. I am Dr. Uzair. Can I know your good name, please? Sir, today I'll have the privilege of doing your examination, cardiovascular examination. Sir, do I have your permission, please?
Yes, sir.
So there will be some specific examinations in which I can have some contact with you. So would that be okay? I hope it won't be an issue.
That's okay.
Thank you so much, sir. I hope it will be a good engagement, inshallah. So, sir, if you don't mind, please can you just lay down like that?
Yes, sir. Okay.
Thank you so much, sir. The first step is on the right side of the patient we will start, and the first step in any CBS examination is that inspect from the end of the bed. It is known as end of the bed examination. So we will in the right corner, and we'll do four things. We'll check whether if there is any bluish discoloration of the patient's body, whether we have any sort of pallor or any shortness of breath. Now, how can I know from here if it is a shortness of breath or not? The patient will hyperventilate. He will sort of. So from that I will know. Now I'll come to the specific examination. The first one is, sir, if you don't mind, can I please check your hand?
Yes.
Sir, in the dorsal view, please, let's sit. If you don't mind, please sit, sir.
Yes.
Thank you, sir. Sir, can you please put your hand here? If I can test, sir. Thank you, sir.
Sir, slowly
Okay, sir.
and loudly.
Okay, sir, got it, sir.
Junaid, shut down. Loudly, okay? Slowly, it's okay.
So, sir, may I check your hand, please?
Yes.
So, I'll check the hand. So here, the important point is that we will check both the dorsal view and the ventral view for some specific finding. For example, if I'm looking at the dorsal view of the patient, I will look whether if there is any sort of bluish discoloration, which is cyanosis, which we check for congenital heart diseases, and at times the cardiac failure as well. Apart, I'll check the patient's nail if they are present of any hemorrhages, which is known as splinter hemorrhages, which is a finding of infective endocarditis. Sir, can you please put your hand? Thank you. Now I'll check the ventral. Ventrally, I'll check whether if there is any yellow coloration, which is known as xanthosma, and here it is for the hyperlipidemia. I'll check whether this patient has any black tarring at his phalangeal joints. So if that is present, that means the patient smokes. And I'll check for some specific finding. For example, if I have got some specific nodes here, which is known as the oscillar Janeway nodes, which are present in the of course present in the infective endocarditis. Now, sir, if you don't mind, please, can you do like that for me, please, sir, like that, if you don't mind, please. Thank you so much, sir. Now, this is a test specifically for the clubbing, and it is known as the Shamrock window test. Now, firstly, clubbing is when our nail bed gets a bit up, or the angle between the nail bed and the nail widens. So, how from this specific test, the Shamrock window test, how do we know it is clubbing? If there is any space between the nails, so can you please show it?
Yeah.
If there is any space between the nails, it means that it's fine. But if there is no space, then in that case, it is a case of clubbing. Thank you, sir. Sir, can you please put your hands forward like that, sir?
Yes.
From either to clubbing, sir. So yes, sir, if you don't mind, can I check your nails, please?
Yes, please.
Sir, if you don't mind, can you do it like that? So, this test is known as the Shamrock window test. So, please can you show them? This is known as the Shamrock window test. If between the nails we have got some space, that means the nail is not clubbed. Now, what is clubbing? Clubbing is when there is space between the nail bed and the nail, and it is very common in cyanosis. And as we said, cyanosis is seen in congenital heart diseases very commonly. So it is for clubbing, and as I can see, sir, is perfectly normal. Thank you, sir. Sir, can you put your hands forward, please? Thank you, sir. Here, what I will do is, firstly, I will look for the temperature here. Now, why am I looking for the temperature? I am looking for any signs of vasoconstriction or vasodilation, which is again a very important part of the CVS examination, the cardiovascular examination. Sir, if you don't mind, can you please put your hand dorsally? Thank you, sir. Can I have to press it? Can I press it, sir? Thank you. So now I'll press it for 10 seconds. Now, why am I doing this? I am doing this to check capillary refill time. For 10 seconds, I will press upon it. Okay, I pressed upon it, 10 seconds are done. Now, after 10 seconds, if inside 3 seconds, then sorry sir, like that, thank you. After 10 seconds, if inside 3 seconds it comes back to the normal, that means it is a normal capillary refill time. But if it does not come back to the normal, so in that case we have got a certain set of disorder which can be lead to many cardiovascular problems, even heart failure. Thank you, sir. Sir, if you don't mind, can I just put your hand like that in the ventral position and at the level of the heart? Thank you, sir. Now, sir, I'll have to check the pulse if you permit, please. Now, a very important part of the cardiovascular examination is checking the pulse. So, with your two fingers, we locate the radial pulse and we'll check for the radial pulse here. Okay, we check the radial pulse we will feel it, observe for a moment. Now, something that is very important is we'll check two things very commonly here. One is the rhythm of the pulse, the other one is the intensity of the pulse. Now, sir, it's normal, sir, can you please put other hands forward. Now, I'll do something very important, and that is I'll check both of them together. Okay. Why am I checking it? I am checking it whether both of pulses are coming at the same time. Why? Because we've got a very specific congenital condition known as the coarctation of aorta, in which there is a delay. We call the radial delay. Even we can check the radial plus the femoral artery, and in that case it's called the radiofemoral delay. So coarctation of aorta is diagnosed. It's a very diagnostic pathognomic feature of coarctation of aorta. Sir, if you again put like this, thank you. Now I'll locate and check for the brachial pulse. It is also very important. It is mainly at the anterior lead to the elbow joint, metal fossa. So that is where we check it. Now, sir, another important is like, sir, now I'll hold your hand like that in the pulse position. You can do it like that, okay? And sir, briskly I will put it up and then I'm gonna put it down, okay, sir? So you are ready? Like, sir, just make it soft, okay, please? Why am I doing this? I am doing this specifically to look for the collapsing pulse. It's fine, sir. I'm looking for the collapsing pulse, and if the pulse collapses with this brisk increase and the gravitational force of the blood, so in that case, it is a case of aortic regurgitation. So that's why we have to check that as well. Thank you so much, sir. Sir, I have to do an auscultation test on your neck region. So if I'm permitted, please. Thank you, sir.
Okay.
Gentlemen, first when we put this because stethoscope, so always remember this side should be towards the ear. So because when you put it, it comes into that eardrum. So it's going to be like that. So I'm permitted, sir.
Yes.
And to check for the carotid, mainly you should use the bell of the stethoscope. So to locate it, mainly it is mainly present between that between the both heads of the sternocleidomastoid muscle. Yes, sir.
Yes.
Thank you, sir. It is perfectly normal, and I'll now palpate it as well with your permission. Thank you, sir. Now, why am I checking it? I am checking it for carotid bruits. Carotid bruits is another very common feature which is mainly seen in the heart failure patients. So we'll have to check for the carotid bruits as well. Thank you so much, sir. Now, once that is done, so another important feature is the jugular venous. We check for the jugular vein distension and the jugular venous pressure. Sir, if you don't mind, can you look at that 45 degrees completely to your left? Thank you, sir. Now, if in any case the patient is looking like that, sir, can you please just move around so we can clean?
Yes, okay.
Now, we'll check here between the sternocleidomastoid muscle, the both heads of it. In this area, the patient is looking at that at the opposite direction, and if in any case, like for example, it's a case of we've got a left-sided heart failure, sorry, right-sided heart failure, and we've got a jugular venous distension, so there is a bit of bulging, and we can easily palpate that bulge. Okay, now that is very simple, but there's another very important reflex through which we can check for the jugular venous pressure or the jugular vein distension. That is known as the hepatojugular reflex. Sir, can you please lay down? And sir, please put your head in the same position at 45 degrees. Thank you, sir. Here, in this right upper quadrant, close to, not very close to midline, but in this right upper quadrant, we've got a very important organ of our body, the liver. We are gonna press, not palpate, we're gonna formally press on the liver. If we press on the liver, here we go, you press on the liver, and once you press on the liver, if there is an increase in the jugular vein or there is a distension, so this is always a very classical case of heart failure. So that's why we have to check that as well. Thank you, sir. So you can please. Now, another thing that many of us, we don't give very importance to, but that is very important because that is the cause of many heart diseases. We look for the facial features related to the cardiovascular examination. So, sir, can I please look into your eyes? Thank you, sir. So, we look into eyes and we look for any sort of yellowish coloration, the xanthelasma. We look for the yellow arc, which is a sign of hyperlipidemia. And hyperlipidemia is the cause of many cardiovascular diseases, hypertension, and which will lead to atherosclerosis and many other things. That is the cause of it. Okay, sir, can I just lay it down? I put the lid down. Here I will look for some pallor, and that will be the conjunctival pallor for anemia. I will look. Now, sir, please can you open your mouth? Thank you. Here, sir, please can you go? Here I will look for the central cyanosis, and for many other associated conditions, like for example angular stomatitis, that is associated with anemia and with heart diseases. So it is for the symptomatic thing we are looking for. Now, sir, I will have to inspect your chest, please. So if you can just lay down. Thank you. Firstly, I will look for any deformity, any congenital deformity that is present. So I will look for it from all sides. I'll just completely make myself satisfied that yes, my patient is completely fine. If that is okay, now I'll have to look for some past scars. For example, why is that important? I look for a scar that is present in that central region, which shows that the patient had a previous thoracotomy or sternoiliac. I look for a scar that is present in the clavicular area. So that was some pacemaker insertion scar. I will look for some scar in the subaxillary area. That can also be for some lateral thoracotomy surgery. So these are very important points because that will give us a better understanding what the patient has faced in his past regarding any cardiovascular disease. Thank you, sir. Sir, can you just please? No, thank you, sir. Now, another very important thing. The most one very important point is we look for the apex speed. Now, apex speed is extremely important because many of our murmurs, many of our abnormal heart sounds can be heard at the apex speed, and we can diagnose them. So, very importantly, how do we palpate the apex speed? So, the most important point for that is that we have to locate our apex speed. So, where is the apex? It is present at the 5th intercostal space in the mid-clavicular line. Okay, so I'll have to locate it, so I'll have to, no issue with that. Firstly, the 5th intercostal space. What is intercostal space? Between the two ribs or between the intercostal ligaments. So here we go. It's got 1, 2, 3, 4, and this is the 5th intercostal space right here in the mid-clavicular line, and here we'll palpate for it. And if there is any abnormal, like murmur can be auscultated, but any thrushing sound, we'll have a better look at that. Now, another thing is, before I go to auscultation, the most important point of this cardiovascular examination, and that is, before that I will assess for any parasternal heave. Now, here we've got the sternal, at the sternal head, or we can say at the clavicular head, we'll here palpate, and we'll check out for it. And if we found some heave is a sound of like a fluidic sound, and if that is present, that will be a diagnostic of a left ventricular hypertrophy. Now, the most important, the most diagnostic point of our cardiovascular examination is the auscultation, the most important. So for that, I'll have to use my stethoscope again, sir, and I'll also have to use the stethoscope on you. For your permission, please. Thank you, sir. Again, the right way of putting the stethoscope. So, there are 4 most important auscultatory points that we have to look at, and that are the 4 most important valves, indeed the 4 valves of our heart. So first we will go for the mitral valve. Mitral valve is present in that apex area, the fifth intercostal space in the mid-clavicular line. We're going to locate that. So here we go again. 1, 2, 3, 4 and 5. 5 and the mid-clavicular line. So here we're going to check it out. The second one is the tricuspid valve, which is at the fourth intercostal space at the sternal border. So again, from here we start. It's sort of 1, 2, 3 and 4. And here at the sternal border, we're gonna check it. Now coming to the pulmonary valve, it is the left sternal border at the second intercostal space. So we've got 1, we've got 2, and here we're gonna auscultate it. And last one, the aortic valve, which is a bit different in a sense that it is at the right sternal border and it is again at the second intercostal space. So we are going to check that as well, just like that. For example, firstly we are said about the mitral, and during that another important point is to locate the first third sound. We'll also have to constantly palpate the internal jugular vein. So from here I'll start with the palpate jugular vein and I'll check for all 4 valves. For the mitral valve, for the tricuspid valve, for the pulmonary valve, yes, and for the aortic valve. Now I want to add some important points here, and that would be in the exam that very diagnostic of that we hear the heart sound to hear some abnormalities if they are present. For example, murmurs, and mostly the murmurs that we hear are during the expiratory phase. So for that, sir, please take inspirate and then expirate, and at this expiration point we are gonna auscultate the same point for the murmurs.
Continue.
So all of the murmurs are at the expiratory point. Another important point is another maneuver that we call as the accentuate maneuver. Sir, can you please just lay down? Thank you, sir. Sir, can you slightly rotate to the left side, please? Okay, that's enough. So during this time, a lot of blood goes towards the mitral area, and for that the mitral murmur are very well heard in this accentuate maneuver area. So that is very. Now I am going to be at the very end of my examination. Sir, can you sit down? Thank you, sir. I'm going to go at the back side. I'm going to use my stethoscope again. Thank you. So can I check?
Yes.
I am here gonna check the back of the chest on the bilateral area for some specific fluid sounds that are present for the pulmonary edema. And now coming toward my very last step, and that is I am going to check, and sorry, just to add, the pulmonary edema here is specifically for the heart failure. It's mainly present in the left-sided heart failure. And now the last thing, I'll check the back at the very bottom, the sacral area, and I'm going to check the ankles. So here for the sacral edema, the ankles for the pedal edema, and which is again a feature of a aortic heart failure. And thank you. That is all. Thank you, sir.
Okay, clapping please. Dr. Uzair here has done very good job along with Dr. Rehman. Can you show your notes to camera, please?
Yes, sir.
Yes, you can just bring it near the camera. Okay.
These are my patients, mind you.
Okay, go from down and then go up. Okay, good job, Achi.
Thank you, sir.